Sometimes, despite dietary changes, the levels of phosphate can still remain high in the blood. Certain medications called phosphate binders can be prescribed by your kidney nurse or doctor to help lower the levels of phosphate. Jaswinder, do you what binders do you take?
Stella, I take this binder, Sevlamar hydrochloride, 800 milligram. When I started dialysing, it was okay, but about 9 months down the line, I started to itch really badly, legs, back, and then the Sevlamar was prescribed by Dr. McLean. And generally I just take one tablet, any meal I have or any snack I have. But if it's a large, sort of an evening meal, or especially on a Friday, you tend to eat more than usual. So I'd take two tablets. Yeah. And it sort of stops the itchiness, but the itchiness is still there, especially at night. Yeah.
Okay. And they were probably prescribed because your phosphate levels were kind of starting to get higher.
Yes.
And as you've rightly said, you know, one capsule per meal is the kind of the starting dose.
Yep.
However, if you're having a bigger meal, then you can increase that to 2.
Yep.
Some people might have to take 3, for example.
Yep.
We've got different varieties of phosphate binders here. So you've been given this one in a capsule form that you're taking, swallowing with
water.
meals and snacks. But for example, for people who may be struggling to swallow a big capsule, you could take these one here that can be chewed at the end of the meal, or these can be chewed again at the beginning of the meal. Or even sometimes we've got a powder form that you mix in 60 ml of water and then you just take your prescribed dose.